New York City, December 4th, 2024. It's 6:44 in the morning. A man steps out of his hotel on 54th Street. He's the CEO of United Healthcare, the largest private health insurance company in America. Suddenly, a man appears behind him and opens fire, 3 shots. Brian Thompson collapses. His killer flees the scene.
Got a male shot outside of the hotel. No prep description at this time.
After 5 days on the run, the police catch the killer. His name is Luigi Mangione. He's 26 years old, and he has a clean criminal record.
The suspected killer, in other news, of United Healthcare CEO is now being held at a federal jail right here in New York City.
Investigators uncover that the attack was premeditated. On the 3 bullet casings left at the scene, Mangione had etched 3 words: deny, defend, depose. This is the very strategy private insurers use to reject compensation claims. Within days, the man who assassinated the CEO of a company that denied nearly 30% of reimbursement claims last year finds himself backed by millions of Americans.
I think a lot of people really resonated with Luigi and the pain that he's suffering, because we know or know a lot of family members who are also suffering from similar things because of healthcare companies like United Healthcare.
You know, I think that act, as terrible as it was, did allow the discourse to be opened up.
We don't want anybody killed, but at the same time, somebody's got to stand up to these guys. I mean, I hate to say it, but he's become a hero. He's become a hero.
Stand up! Look around! There's a healthcare crisis in this town!
T-shirts, mugs, flags. Luigi Mangione's face is everywhere. Polls show that 1 in 4 Americans sympathize with him. So how does a killer become a Robin Hood-like martyr almost overnight? We set out to understand why, for some, Luigi Mangione has become a vigilante, the voice of an angry America. It's 7 in the morning, and this college in Connecticut is already packed. People have come from all corners of the state just for a chance to see a doctor. And for hours now, this makeshift hospital hasn't stopped filling up.
I had a little bit of soreness down at the bottom. It's more of like, I feel like there's always pressure on that.
Paul works as a school janitor. Despite the pain, he waited several months to get free treatment here.
I went once out of pocket, it was over $100 for just the basic. And I was like, okay, I won't be going back for a while, because it's a lot of money when you're paying out of pocket.
Paul's circumstances aren't an isolated case. Most of the people here aren't unemployed or homeless. Many pay hundreds of dollars each month for health insurance, insurance that barely covers anything.
I do have insurance, for to include dental, or you have to add that on to your primary. So it gets, it could be anywhere between $500 to $1,000 a month just for your insurance. And that's kind of prohibitive when you're retired, so it's a lot of money.
In 2023, a study revealed that 43% of American adults with private insurance skip medical care because it costs too much.
I haven't had a look at my teeth in a long time.
A long time?
Yeah, maybe 8 years. It's been a while, yeah. So I have to pay out of pocket through the state. I got 2 kids, so it's a little hard.
Today, 60 million Americans have no access to basic health care. That's why the NGO Remote Area Medical sets up mobile clinics across the whole country. Originally created for war zones and remote communities in developing countries, it now operates in the heart of the United States.
Here you'll see this one has a green target, so you're gonna look at the green target, okay? And just focus on the green target for me. Excellent. Awesome.
Yeah, remember that was
Yeah, these are probably 4 or 5 years old now because I got to do my best to keep them as long as I can. These ones?
Because it's not about what I like, it's what do you feel better, more confident in.
I'm going with these.
Okay, perfect.
The last time I had an eye exam and I was looking at glasses, it was going to cost me about $400 out of pocket. So, big savings. All right, let's hang on.
People like me, where we have insurance, but the co-pays are ridiculous, or like he was saying, they'll cover the exam, but the glasses, what good is an exam if you can't buy the glasses?
A broken, unforgiving healthcare system that leaves millions of Americans behind. The head of the NGO has felt the anger building for years and says a shooting like this felt almost inevitable.
You remember when you heard what's happened with Luigi Mangione and the CEO shooting? What was your reaction?
Felt sad. Anytime someone loses a life, it's sad. But I can understand how frustrated people may be. One of the richest countries in the world with the poorest example of healthcare.
However, the story of Luigi Mangione did not begin with blood and revenge. He grew up here, in Baltimore's Little Italy.
Give me a little bit of marinara. A little bit of marinara for me.
Gia Franschetti has run this restaurant for 15 years. She's a pillar of the Little Italy community, and the Mangione family were regulars at her place.
They're probably going to be very private for a long time, till this cloud is over them and finished and gone. The father, and that's Kathy, and I believe that's the daughter. I thought they only have one daughter, maybe they have two, and that's, of course, Luigi.
These days, the family keeps a low profile, but they were once among the most prominent in Baltimore. Luigi's grandfather came over from Sicily, made a fortune in real estate, and built an influential dynasty with deep roots in politics and business.
Family is well known in our Italian community only because they're a wonderfully generous family. To me, they are the epitome of the American dream. You come, you work, and then you become whoever you want to become.
As a teenager, Luigi was accepted into one of Baltimore's most prestigious schools, the Gilman School, a private boys' academy built to shape the elite. No one here wanted to speak about Luigi Mangione. All that remains are the archives from his time at Gilman.
Good afternoon. Thank you all for being here to celebrate Gilman's 116th Founders Day.
In 2016, Luigi Mangione graduated top of his class. Today, he's facing the death penalty. His exact motive remains unclear. What we do know is that in 2023, he finally underwent spinal fusion surgery, an operation doctors have postponed for years. Those years of pain may have fed his growing hatred towards the healthcare system. A hatred now shared by many Americans. For them, Mangione isn't a killer, but a kind of avenger, a man who acted on behalf of the thousands of Americans failed by their insurance companies.
This is from our wedding.
Yep, 1991.
Oh my gosh, we were so young there.
Yeah.
We look so like babies.
Yeah, I was 20.
I was 19.
She was 19 when we got married, so. And she still has the dress.
I do. But it was love at first sight, pretty much, so.
Sarah has been battling breast cancer since 2020. Since then, her husband Jerry has had to work for both of them. He's a warehouse worker, pulling 55 hours a week, often overnight, for $3,000 a month, $1,000 of which goes straight to insurance. A few months ago, Sarah's condition took a turn for the worse.
The cancer spread in my spine. There was a new lesion.
Her doctor then prescribed an urgent new round of chemotherapy, a treatment costing $17,000 a month, meant to be covered by her insurance, United Healthcare.
Twice daily. And then these are the denial letters that I've been sent from the insurance company. We received a prescription drug request from your healthcare provider for capecitabine 500 milligram tablet. The requested medication must meet specific criteria and coverage cannot be authorized at this time. Anyway, they sent me another...
United Healthcare ruled that the treatment recommended by Sarah's oncologist was not appropriate.
I trust more my doctors because my doctors have examined me. The insurance has never met me. They don't know me. They've never examined my body. They know my case only on paper. Insurance started denying me, and I was off any treatment for 2 months. 2 whole months. And when you have stage 4 cancer, 2 months without treatment is scary. So I'm getting pain kind of by my jaw and like behind my ear a little bit. And that started getting worse. And so I can feel it growing, you know, like that felt weird. And to not, you know, this felt like an emergency to me. And it felt like nobody else, like crying out, like, help me. And everybody's just walking past calmly. Like, it's no big deal. I mean, this is life or death for me. This is United Healthcare. Hello?
Hi, Sarah. It's Kim, Nurse Case Manager with United Healthcare, just reaching out for follow-up.
Hi, Kim.
If it's not approved, you know, like we talked, Sarah, you know, try to submit some information showing that this is, you know, a special situation that requires that.
Is there anything that I can do on this end that can help?
As far as for the prior approval, no, I don't really think so. It's all pretty much driven by the provider and what they've, so, yeah. All right. Well, you take care, Sarah. Have a good weekend. Get some rest and have some fun. Take care. Bye.
You too. Bye-bye. It just feels like there's not a human component or something like that. Like they're just looking at a computer screen saying denied, or, you know, like the decision is made by a book, not by a human. So, I don't know. Like, instead of crying, I'd rather laugh. It's a little easier to get through it that way, you know? It's ridiculous. This is all ridiculous. He gets angry. He gets more angry than me.
Yeah, I get a little. She told me she got the third denial of the letter, so I was pretty upset. Maybe wanna do a Luigi, you know, like if something were to happen to her, we don't have any kids or you know, nothing specifically holding me here. So I was like, well, maybe I could make a message too, you know. I think, you know, personally, sometimes, you know, with the rich guys, you gotta be a little violent to get their attention. And maybe that's not the right thing, but that's the only way they seem to listen.
New York, just a few blocks from where the shooting took place. This is where Stephen Cohen works. He's a lawyer who specializes in class action lawsuits, high-profile cases that often make headlines.
So if you see the building just in back of this one, the tall building, that's where Luigi is going to be tried. State Court, Criminal Division. This is where we're fighting on behalf of the 250,000 retirees to maintain their health insurance. This is the civil Supreme Court of the state of New York.
For over 15 years, Stephen Cohen has been representing patients driven to financial ruin by unjust claim denials, as well as families who have lost loved ones after being denied care.
This is one of the most important fights I've ever had in my life because it affects people, so many people, in such a fundamental way. To provide people with access to quality health care that they can afford is just fundamental to life.
Hey, good morning, Miguel.
Hey, good morning.
George, we okay on that Lovo appeal this morning?
Great.
Good. I'll check in right after, okay? Thank you. You know, I am a capitalist. I am not against private industry, but show me one positive thing that an insurance company has done for healthcare. Insurance companies are private companies that are responsible to their shareholders, not to their members who get the insurance, but to their shareholders to maximize profits. And they figured out about 20 years ago And it came about as a result of a McKinsey report to a particular insurance company that recommended a strategy they would call deny, delay, and defend. And what deny meant was, we're going to deny a procedure, we're going to deny a test because it costs us money. If it's appealed and we have to do it, we delay it as long as possible. Maybe the condition will go away. Maybe a cheaper test will emerge. Sometimes people die. Too often, people die as a result of a delay of diagnosis and treatment. And then if we're sued, we're going to defend it aggressively. Thank you for taking care of that. Let's not send that out, okay? Okay. Yeah, I'm going to need some help on something else today. Okay. You'll help. Yeah, of course. Julia.
We reached out to United Healthcare to ask about its practices. After a few days, the company directed us to its website, where it claims to be combating misinformation. As for an interview, they referred us to the AIHP, the National Trade Association for Health Insurers. The lobby group never responded. To better understand how the system really works, we spoke with a former United Healthcare employee. A few years ago, Natalie Collins was still part of the machine, and she knows its inner workings all too well.
In all hospitals across the entire United States, every single physician's office, every single humongous building of amazing physicians and amazing nurses, they're all battling this every single day.
After years of staying silent, Natalie Collins finally decided to speak out, triggered by the events of December 4th.
Luigi started it. It made us start talking. I mean, I don't want anyone to lose their life. I definitely don't condone anyone losing their life, let alone being just simply hurt at all. No one should be hurt. But also, the people that are working with these insurance companies and healthcare systems, they are dying. People are mad. It has to stop. I mean, we're losing so many people, and so many people are losing their lives. Not physically completely gone in some situations, but losing limbs, losing body parts of, because they didn't get treatment in time.
Well, I worked for United Healthcare for like maybe 9 months. Here's my story. I worked in the medical claims department and went through training for about 2 to 3 months to get out on the claims rep floor, and was taught so many different ways to deny.
It was this TikTok video that marked Natalie Collins' turning point. Within days of posting it, the clip had tens of millions of views. She became, almost overnight and without meaning to, a symbol of the fight against private insurers.
Yes, the element of protection has been very, very important through this entire process of talking about this. Insurance people, they have done some very scary things. These higher ups, they have money, they have power, and I don't want them to come on me. I have a beautiful family. Me and my husband, we went and bought me one, and he got a new one, and we got all of our ammo, and I have, let's just say, I have things in place to protect myself when I'm out, especially with my kids.
Natalie Collins asked us not to film the location of her home, where she lives with her husband and their sons.
Hey, Mom. Hi, how are you? Come on, how are you?
Good.
Hey.
I came back.
How's your day?
Hi. Yes, I was so excited. It was a big building, big corporate, beautiful building, and I've never worked in an atmosphere like this. I was processing medical claims all over the country.
Natalie was expected to deal with between 120 and 180 calls every day.
We had coaching to be able to deny it. There was special messages that would come up that even though it is covered and it will eventually be paid, the company that the person worked for didn't have the money in their account, if you will, to pay it, so we had to delay it. So then we would have scripts on the screen explaining what to say to them to get them off the, maybe to satisfy them. So they had a preference to be 7 minutes or less on a phone call, especially for an actual phone call coming in. We had, you know, it was like, it would flash red once it passed a certain time. I think it was like 15 minutes. It was like, get off the phone. It was so, so sad to hear these conversations and these situations that people were in, whether it's a client or a patient or it's a provider's office that is so desperate to help their people, and they are so mad at us, you know, having to tell them that they really don't have the coverage for this treatment, or they're gonna have to pay out of pocket. I wasn't able to sleep well at night. How do you sleep after knowing that you had way too much power that day? I am just a girl. I should not be able to hit a button and make such a determination on someone's life. That was sickening.
Since the Mangione case, the silence has started to break. The methods used by these companies are being exposed, and it's fueling the anger of millions of Americans.
Are you aware that we have visitors with us? Yeah. Okay. So fun. Okay, come on in. Great, perfect.
We're in Austin, the capital of Texas. Dr. Elizabeth Potter is a breast reconstruction specialist. Today, she's fitting a prosthesis for this patient, the final step in a long medical journey after breast cancer.
We're doing fat grafting for months for us to kind of see how much fat. So surgery will take about an hour and a half or so.
No, so and I think this is my final.
We're done.
Final, done.
Yeah.
We reached out to several doctors. All of them declined to speak. The vast majority of healthcare professionals work for insurance-linked groups. Dr. Potter is one of the last independent specialists in the state of Texas.
So today we have 34 patients. It's a lot. We take care of, I think it's around 40% of the women in Central Texas with breast cancer. We don't refuse anybody. We just fit them in.
Elizabeth Potter sees the insurance giant's abuses every day. This patient, for example, just spent 2 nights in the ER after suffering a pulmonary embolism.
Do you feel in that moment like you're going to the hospital, they tell you have a pulmonary embolism? What are you thinking?
I'm not thinking about insurance. I'm thinking about, I can't breathe right now, something's wrong. And I know he's terrified.
She nearly died. And just after returning home, her insurance informed her it wouldn't cover the cost, stating her hospital stay was not medically necessary. The bill came to $100,000.
I don't understand how it's not medically necessary. I just don't.
On one hand, you can understand where somebody comes from, being that mad about things, but I can't condone murder at all. I mean, but having a giant corporation like that it's essentially making money off of people being sick is not right.
This is United Healthcare. This is United Healthcare. Yeah. Yet again. Same letters. You had a life-threatening condition. You have insurance. It should be covered, period.
Yep.
And they are fighting it with technicalities and turns of phrase. That's obscene.
Dr. Potter doesn't just condemn these tactics. She actively helps her patients build medical case files to push insurers into paying up. And it's a tough fight. On top of denied claims, there are endless delays. The infamous delay, part of their strategy. She even employs 2 full-time staff just to chase down insurance approvals for her patients.
So, these are the ladies.
Hi, good afternoon. My name is Mary. I have an authorization approval on file for a member who is scheduled for an outpatient surgery on the 19th.
All day long, these ladies are translating what I do clinically into that world, into that language of insurance, or navigating that system that is like full of obstacles. Yeah.
This is for outpatient surgery elective with a 90-day date range of 2/28/2025 to 5/28/2025.
That is correct.
We have diagnosis code of Z90.13, Z15.01.
Yes, ma'am. So I needed the call just to show you. So this patient has been coming in for quite some time, but the discussion with insurance has started since December.
What is the main quality you need to negotiate with those insurances?
Lots of patience. Lots of patience, and a certain level of like tenacity. Like we just have to dig in sometimes.
It's a very long and slow process to try to get to the ending point as an approval for the patient, to get that approved so they could just move forward and have their surgery.
I'm tired of it. I am tired of it. And I think that we're all figuring out in the United States that navigating insurance feels like we're unraveling a scam. We've been paying into a system that isn't there when we need it.
And yet, the cost of health coverage keeps climbing. Today, in the United States, 2/3 of all personal bankruptcies are caused by medical debt. Behind every denied claim, every delayed treatment, there are human lives, complicated, painful stories, like Sarah and Jerry's.
See you today. Okay, drive safe, work safe.
Yep.
Bye.
Love you.
Bye. Bye. I feel mentally pretty solid. I've heard of people losing everything just to pay for their cancer care, but I've also heard of people like just giving up and letting the cancer, like not treating it and stopping treatment.
After 3 months without treatment, Sarah has finally resumed her chemotherapy, but only thanks to a private foundation moved by her story. A temporary victory, whilst America still waits for its healthcare system to be healed.